From Boston University and BU Alumni Relations, welcome to Proud to Be You Around the World. I'm your host, Jeff Murphy, and this season we're taking the podcast on the road to meet some of our most interesting and accomplished alumni navigating life and careers in cities across the globe. On today's episode, we're breaking new ground with not one, not two, but three guests here in the studio. Dr. Barry Brooks established Brooks Dental in Winthrop, Massachusetts in 1959. His son, Dr. Howard Brooks, would join the family business after graduating from BU's Goldman School of Dental Medicine in 1987. And in 2018, Howard's daughter, Dr. Stephanie Brooks, would become the third generation to join the family business after graduating from the Goldman School of Dental Medicine as well. Doctors Barry, Howard, and Stephanie join me on Proud to Be You to talk about running a business, family legacy, and reflections on the transformation of their industry over the course of 3 generations. So today we're playing a game of how many dentists can you fit in the College of Communications studio. I have all the Doctors Brooks, 3 generations. Thank you all for being here.
You're welcome.
Thank you for having us.
So, interesting story. We've got a father and a daughter who both attended Boston University Dental School. But Dr. Barry Brooks, you're the patriarch. I was wondering why on earth you didn't attend BU Dental School, and then I had to do a little research and found out that I don't think it existed quite at the time that you went to dental school.
No, I don't think so either. I had heard good things about Loyola Chicago, and it was a wonderful school.
Yeah. And I understand today's your birthday.
Yeah, today is my birthday.
Do you mind if I ask how old you are?
67. No,
Okay.
87.
87. And I understand you're still seeing patients on a fairly regular basis, still going in the office,
a few
still
days
working.
a week, yeah.
Yeah. So you founded Brooks Dental in Winthrop, Mass., right? What year did you start the business?
I think it was December of 1959. That's when I started,
Wow.
a long time ago.
Well, you have the distinct honor of being the first non-BU alum that I've interviewed for the podcast. And if you don't mind, I want to focus on your son and your granddaughter for the
Absolutely.
next. All right. So, Dr. Howard, Howie, let's start with you. You grew up, obviously, with a dentist in the house. Did you, as a kid, have inklings that you might go on to the family business? Or what kind? I know you went to UMass. What were you studying at UMass?
Well, what I studied at UMass, I studied wood science and technology.
Oh, interesting.
So it was, kind of utilized all of the prerequisites for medical/dental school.
Yeah.
So my job was, okay, I want to graduate in 4 years, and I want to graduate with a science background so that I could get all of my prerequisites ready and be able to apply if I decided I wanted to go in that direction. Mm-hmm. I was definitely not sure what I wanted to do when I got out of college at UMass.
I think I read, though, that your parents thought you might be heading toward business school. Is that...
Yeah, that was kind of my decision at the time. It was really a decision when I got out of college to find a job, which I did, and it was in a company called Grossman's. Mm-hmm. If you remember
the lumber
Grossman's.
company. Yeah,
exactly. So they had
sense.
me on a management program. They hired me to become a manager of one of the stores, and I took that and said, well, maybe I'll get my master's and I'll go into business and open up my own business, whatever that may be. But after a year of working in Grossman's and working for someone else, which was interesting in itself, I decided that this was not for me. And so my wife and I were skiing in New Hampshire and sitting down at a restaurant and trying to figure out what I wanted to do with the rest of my life. And at that point, she kind of moved me in the direction of dentistry. Yeah. And that's how the decision was made.
Okay. So tell me a little bit about your BU experience. How did you decide to attend BU?
Yeah, my decision to attend Boston University was really a decision that came about from a colleague of my father. He was involved with the school at the time, and he recommended Boston University as an excellent institution to study for dentistry.
Makes sense.
And
what sticks out about that experience? Do you remember specific classes or professors that you had that were sort of impactful on your career?
Absolutely. Dental school itself was extremely challenging and required really 110% commitment of yourself in your free time. There was very little downtime. Studying at the school for long hours with classmates became the norm. We all basically lived at the school during our time there and became a close-knit family. It was hard to explain kind of what we were going through unless you were going through it yourself.
Yeah.
There were and there are a handful of mentors at BU that shaped my skills and problem-solving abilities. Valdemar Wells as one. He had amazing hands. And to this day, I make my block temporaries, as he taught us to make them back in the preclinical days. Dr. Armstrong was another mentor on the clinic floor. He was tough, intimidating, as many of them were, but fair. His practical knowledge that he imparted on me when I create a crown preparation lives with me today. Dr. Kilgore, Dr. Rakowski, Dr. Hawley, Dr. McManama, and many more had lasting effect on how I practice today.
So you already told me about sort of one big fork in the road that you had in your career. When you finished your Doctor of Dental Medicine, did you already know you wanted to go into practice with your dad, or were you thinking about doing something else? How did you sort of make that decision?
No, when I finished, even prior to going to dental school, my path was going into practice with my father. Sure. There was never any doubt.
Yeah.
So it took a lot of pressure off me while I was in dental school. A lot of my classmates were, what do I do when I graduate? Do I go to graduate school? Do I want to go into a specialty? But for me, it was easy.
Yeah.
And it just really it made the experience that much more enjoyable, knowing where I'd be headed.
Yeah.
And who I'd be with.
Sure. Right. I mean, we talked about mentors you had in school. I can only imagine that your dad has been the ultimate mentor for you.
Absolutely. In general, being able to practice with my father was special because it not only allowed me to practice with my father, but it allowed me to become, in a sense, a friend and a colleague. It was not like my father. Okay, we are now colleagues. And I got to know him really differently than as a father figure. But I never hesitated to go to my father for help. He was and still is a great mentor. It could be a procedure that I was working on that I felt a little uncomfortable with. I'd go into his room and say, "Could you help me with this?" Whatever that may be, without getting into too many details. But
yeah, we don't want to. As a dental patient, I don't really want to know how the sausage is made. So.
Well, it might have been extracting a tooth, and he came in to finish it off.
Yeah, well,
it's just one of many examples.
Yeah. Well, Dr. Stephanie, did you grew up with these two dentists as role models? Did you see that kind of working relationship that they had? Sort of, did that influence your decision to go to dental school in any way?
Yeah, for sure. I think it had a huge influence, and I don't know if I would have thought to go into dentistry had I not had that family influence. Right. I knew it was really special having the two of them, but to a degree, when I was young, I probably did take it for granted. It's like, oh, dentistry runs in the family. Like, doesn't it for everyone who wants to go into dentistry? And when I started at BU Dental, my close-knit group of friends and just other classmates, I got to know them and asked them, I'm like, how did you decide to get into this? And they're like, well, I found it interesting, or I had a good, experience with my dentist when I was little. And so many of them hadn't had dentists in the family. And I'm like, that's so interesting. Like, I feel really lucky to have that working relationship and also to have a good relationship with both of them and know I will most likely be able to work well with them side by side.
So knowing that, I mean, you had exposure to it as out of the womb, basically.
Mm-hmm.
Did you, when you were in high school or even leading in college, did you know you were going to be a dentist, or was it still sort of a question?
I think I always kind of knew that I wanted to go into dentistry. It just made sense for me. Like my father said previously, like he enjoyed working with his hands when he was young. I did too. I loved art, painting, drawing. I loved working with my hands, and I suppose my dad saw it in me that it would lend itself well to dentistry. And also, I love the Boston area. I knew staying here and being in this stable, predictable lifestyle is something that suits my personality. So I think from a young age, maybe around high school, I knew that was what I was going to end up doing.
Okay. So tell me about your BU experience. Again, the same question. Are there specific classes you took, specific projects that you worked on, professors that you had that really stand out and when you think back to those years?
Yeah. I don't have to think back too far. It's still very fresh, but it's a good thing. I think, what makes BU so unique in BU Dental in particular is there are so many faculty, probably I can count in two hands or more, that are still there teaching now that were there teaching when my dad was there, and he remembers them well, and he developed relationships with them. And I really do think those are the ones that helped me the most. I felt immediately drawn to BU because of these faculty members that I felt like they had already known me because they know my father. So, Dr. McManama, Dr. Kilgore, I worked with closely, Dr. Brown, who I know has been here for a ton of years. The older faculty that know BU so well and have been there for a while, and just they also know the struggles. It's not easy to get through dental school. So those were the ones that I connected with the most and sought a lot of advice at it.
And did you know that you were definitely going into the family business the whole time? I read that you had professors that gave you some warnings about the possible pitfalls of working with family.
Yeah, and honestly, I was shocked when I heard that from multiple. I remember them telling me, like, that's amazing that you're going into it with your father and grandfather. It's not going to be easy. It might not even work out. And I'm like, okay, I don't agree with you, but I appreciate your giving me advice. But no, I mean, it's been such smooth sailing. I feel so lucky to be able to go right out and into work when majority of my classmates, almost all of them, went into either residency or a specialty because they just felt like they needed that extra guidance, mentoring, learning. But I knew I would already have that coming into Brooks Dental.
Well, I wondered, too, if that's a generational thing. Dr. Howie, did you have I imagine at the time when you finished at 87 that there might not be as many people saying, oh, beware of working with family, that maybe family businesses were more popular route back then. Not that it was terribly long ago, but were there people in your life that made you think twice about working with your dad?
No, not at all. Yeah. Not at all. Solo practices were what dentistry was back in the day.
Sure.
And now they're more group practice. So you're working with, there's more personalities. And but I never had an issue with my father. He's just laid back and said, hey, I'm open to learning new ways and new technology and new things that you've learned in dental school. Yeah. And he said, go ahead, do it.
Well, you mentioned that, back in the day it was more individual, private dentists. Now it's more groups. You mentioned some of the technology. I'm curious to know, having seen Stephanie go through med school, just finishing just a year ago, how has dental education changed from what you can see? Are there things that, trainings, technology that Stephanie got to do that you wish you had been able to do as a dental student? And also just how has the dentistry industry changed in that time?
Yeah, that's also a very good question. We did everything by hand.
Sure. Back
in the day. Waxing, crowns, making our own crowns. Everything was done with impression materials. Technology has created digital dentistry, in a sense, where everything now is. The x-rays are digital, where they weren't when I was in school. You can digitally make your own crown at the time that the patient is sitting in the chair. You can have it milled and have a crown ready for them. There's cone beam technology, which is a three-dimensional view of the jaw that allows you to absolutely 100% know what you're going to do before you do it. All the measurements are perfect. If you're placing an implant, if you're doing a root canal, you can always go back and look at your cone beam and see three-dimensionally how that bone is formed, how thick it is, what type of root structure there is. So these are some of the things that Stephanie has really completed in dental school that I had absolutely no knowledge of and had to learn as the years went on. And we do. We're pretty much fully digital in our office.
I assume that you as a dentist, it's not you finish dental school and you're done. That you probably have to do lots of continued education in order to stay sharp in your field. How do you stay sharp as a dentist and continue to learn about all these emerging technologies and changes in the industry?
That's one of the things I really enjoy, is continuing my education. There's as a dentist, we're required to have roughly about 40 credits.
40 credit hours for 2 years.
40 credit hours for 2 years, but we usually do well more than that. There's dental conventions. There's even mentors in the field that we'll go and learn from. At the dental convention, you kind of get a feel for what the trends are in dentistry. And then from that, you can make a decision and say, okay, well, I want to follow that trend. I want to go see that professor, that doctor, that instructor on this type of technology. And then you make a decision as to whether you want to move forward with it implemented or not implemented.
Sure. So outside of the sort of ongoing education aspect, keeping up with emerging technologies, Dr. Howe, you obviously have more of a career to draw on. Dr. Stephanie, you're a new, dentist in the field. But my question is, what do you feel are the characteristics that are most important for a dentist to be successful in their practice?
Well, first of all, you must love working with people. That's I think, most important.
Yeah.
And treat them as if they are part of your family. Welcoming them with a smile at all times, being empathetic to their situation because they're usually very nervous about having anything done to them,
sure,
especially in such a personal area as their mouth. But you must love your job.
What is it about your job that you love?
Working with my hands.
Yeah.
Working with people, working with staff, learning new technology, not being afraid to learn new technology and then implement it. There's plenty of dentists in the field that really are afraid of change, and you cannot be afraid of change or concerned about change if you want to.
You're going to be left behind.
You're absolutely right.
Right. Stephanie, how about for you? Anything that you've learned, sort of right out of the gate, lessons? Any way that the actual work that you were studying is different from what you expected or anticipated, or did you have enough exposure to it your whole life that you kind of knew what was going to happen?
No, short answer. You do all the learning once you leave dental school. They give you the basics and, know how to do these procedures. And then once you're out and working and doing the real thing, you're given a lot of curveballs and you have to decide, be quick to decide, use good judgment, what to do in those situations. So I think having good judgment, being able to, make good snap decisions. Those are some characteristics, but I also some that align with my father's. Definitely empathy, people skills, honesty and truthfulness always. That's, the oath we took, BU Dental. You have to have great organization, in terms of time spent and just organization of procedures, making sure you're prepared for the day. And obviously all these things tie into if you love what you do, you'll be more motivated to kind of get all these things together and make it happen.
Yeah. Let's talk a little bit about the family business aspect. I think a lot of people must ask you questions about that. How do you navigate balancing sort of your passion for the science, your passion for helping your patients with running a business and running a small business at that? What percentage of your time is spent doing, the actual running of the business versus seeing patients?
I think that is one of the most challenging parts of dentistry, because all day long you've got your hands in someone's mouth in a sense, and at the same time you have staff coming to you with questions. You have business decisions you have to make. So as much as difficult it is to just do the dentistry, you also have to manage the business. How much time do you have to manage the business? Not much.
Right.
Not much. A lot of that is done at home, away from the office.
Yeah.
We have monthly meetings with the office pretty much shut down. But there's a lot of time most of the time I decide on the business aspect away from the office.
Yeah. And I mean, I have a father-in-law who's an optometrist, and he's helped me understand a lot of things about private practices that I didn't know and never really considered. That I don't know if this is true for you, but if you wanted to take a vacation, basically anytime, and you're here today, anytime you're not seeing patients is basically money that's not coming into the business. So how do you plan for vacations and time off and things like that? I mean, is it feel like a constant push-pull, sort of, trying to live your life but also make sure that the business is successful?
Mm-hmm.
Yeah, well, exactly. That's exactly how it was. There were many years, and my father, could tell you that, when I go on vacation, and I tried to keep it, a week, 10 days at most, I still had to make payroll. I still had to deal with the patient calls that came in. I had someone that helped me out, a colleague that would cover for me. That is a challenge, but fortunately, that's not the challenge for me anymore.
It's a challenge for me
because I have my daughter. But at the same time, it's different with a group practice now.
Yeah.
So we have an orthodontist in the practice. We have a periodontist that comes in and helps us out. So yes, to a degree, that is true. There is no income occurring, but more so now.
So you're obviously doing some things outside of just seeing patients. Is that stuff that you thought about when you considered being a dentist, having to do payroll or some of those other operational things?
Well, I'd have to echo the fact that it's definitely, at this point, probably the most challenging thing, just getting my feet wet with the business aspect. And at this point, when I really am trying to focus on the dentistry and some procedures I'm doing for the 5th, 6th, 7th time at the beginning, maybe a year ago, and I had to really focus. But again, especially if my father wasn't in the office at the time, I was having to deal with the whole runnings of the staff and the day-to-day routine. So I think that it's very difficult. But every day I'm learning and seeing what he does and just trying to incorporate as much of that into my brain. And just a lot of it is learning on the fly. There's only so many business courses you can take, because I feel like dentistry is, especially private practice, such a niche field, and you just have to learn from your mentors.
Sure. On the business end, just another note, it's really not something you can go to a class and learn. You have to apply that experienced knowledge that you've developed through the years on how to run a business. And so, little by little, I'm giving Stephanie, as she's ready, kind of more responsibility with that, and she's taking it and doing a great job.
I'm curious to know I have an idea of what the benefits of working in a family business would be, but for both of you, if you could give us an idea of, both the benefits and the challenges that people might not see from the outside of operating a family business, particularly a 3-generation family business, things that people might surprise people about, what it takes to be successful in that environment.
Well, I think for dentistry, the benefits of a family business is how our patient base sees that dynamic.
Yeah.
And they feel much more comfortable coming into the practice knowing that my daughter, Dr. Stephanie, is now in the practice. They feel as if they're going to be treated properly, like I treated them. It's not going to be a mercenary that comes into the practice and just wants to do work and get paid for it and go somewhere else in 2 years. They know that Stephanie's in for the long haul. So there's this, almost immediate kind of, confidence that they have in seeing Stephanie, knowing that she's my daughter.
Sure. Stephanie, any comments on that?
Yeah, I definitely feel that. Over the course of the past year and a half, I've met so many patients that started with Dr. Barry and then went on to develop trust in Dr. Howie, and then now see me, and that having that immediate sense of trust, like, yes, I feel okay seeing you. It's huge in dentistry, and it's a good feeling, and it's something that probably if a new dentist goes into a corporate practice or anywhere where patients don't know them, you're really having to start more from scratch and almost prove yourself in a way. So it's a good feeling, and it's very unique.
I didn't ask you, did you consider not going to BU for dental school?
It was an easy decision to choose BU. I was choosing between BU and Tufts, actually, and the interview process kind of solidified it for me. They were both very different experiences. Even you can get wowed by – I was wowed by the atmosphere at Tufts, the beautiful facilities, it's all new. And at BU, they hadn't started any of the construction at the time in the Goldman School. But that didn't really matter so much because you just got a great feel. They wanted you there. Even if it was the interview day and I hadn't yet been accepted, I felt like they wanted me there, and it was a good feeling. It felt warm. So ever since that point, I was like, BU is the place for me.
Well, and I know that it continues to be important to you. You've already been asked to join the Goldman School Dental Medicine Alumni Board. I'm curious to know, why you've felt that it was important to raise your hand and be involved in that. Yeah,
I'm serving on the board. I love it. It's a really fun experience because I was actually asked to join. I received the Richard Fercucci Award at the awards ceremony right after graduation. And for the recipients of that award, this became a thing in the past, I think 3 years ago. They asked the recipient of that award if you'd like to serve on the board, and I'm like, absolutely. I knew already a few people on the board from being faculty, and it's a cool experience to finally be on equal playing field, colleagues with these people, and really be able to talk about, life in general, and also be able to contribute my different perspective on the alumni board. Being such a new graduate, I feel like I offer a different perspective.
Yeah. Well, as you consider the years of your careers, and Stephanie, yours has been just about a year that you've been working full-time, but Dr. Howe, you've got a few more decades to draw on. You've got a young person, one of your patients who's like, hey, I'm thinking about maybe being a dentist someday. What would you tell them?
Well, the first thing I would tell them is that I love my job, and you need to love your job.
Yeah,
no matter what it is. It's not about the money. It's not about the prestige. It's what you love doing from day to day. You spend more time there many times than being at home.
Yeah.
But what I love about the job again is changing people's lives. And one of my sayings is I change people's lives one tooth at a time or one mouth at a time. And it's a great feeling. You can take someone with low self-esteem, and I'll tell this to the person that's interested. Because of the way their teeth look, and they're afraid to smile. So other people may perceive that person as being unhappy or sad, when that's not really the case. They may not get the job that they're really qualified for because of how they present themselves. They're not smiling. They don't look confident, self-confident. So just seeing the first look in their eyes after completing treatment, and they see themselves in that mirror, that's what dentistry is all about. Getting someone out of pain also has the same effect. Wow, I can chew on that side again, and I don't have to miss work. So there's a lot of you're helping people.
Yeah.
If you want to help people, and you like working with your hands, you have to have good dexterity skills.
Yeah. Well, and there's a whole scientific aspect to it, too. I mean, well, Stephanie, how about you? What are a similar answer about the things that make you happy about doing that work?
Yeah, I think I agree with everything that was said. You have to be really determined. Like, every day is it's also, to a degree, it's fun because every day is different. You're facing new challenges, new personalities in your patients, and a lot of them love coming to see us. But then new patients, people that are nervous, they honestly don't. And you have to be prepared for that. You have to be resilient and just determined, make every day the best day. And that it takes a certain type of personality. If someone wants to become a dentist or healthcare field in general, it takes a certain type of personality to be able to deal with that and bounce back day to day and see the good in every day and just try and keep plugging along.
Yeah. Well, Dr. Barry, you've been sitting quietly and listening. I'm curious, what year was it that you founded Brooks Dental?
I opened in December of 1959.
1959. Well, congratulations on 60 years. How does it feel as the founder of this business to sit here and listen to your son and your granddaughter talk about the family business, the passion they have for it, and knowing that you've created this Winthrop institution that hopefully will continue for generations more?
Well, it makes me very happy. We have 6 children, and Howie is the one that decided to go into the dentistry, and he has 3 children, and one is going into dentistry. It's a wonderful thing. We get along very well together. I know other people that I've heard with family members have had problems and had to split up. We'd love to work together, and it's worked out fine. So we're very happy about that.
Well, again, happy birthday, 87. When are you going to hang it up and relax and retire for a little while?
I feel so healthy and happy to help, but now that Stephanie's in, it makes my work a little bit easier or less coming in. But at some point I'll stop. But right now I'm still working and still enjoying it.
Good for you. Well, and congratulations, all 3 of you. Thanks so much. It was really interesting hearing your story. I appreciate you sharing it with us.
Thanks.
Yeah, thank you. Thank you very much for having us.
My thanks to Drs. Barry, Howard, and Stephanie Brooks for joining me on the podcast. It was so fun for me to hear their story, and we're so proud to count both Howard and Stephanie as members of our alumni community. If you'd like to learn more about their practice, visit their website at winthropsmiles.com. On behalf of everyone on the BU Alumni Relations team, thanks so much for listening to Proud to Be You. If you enjoyed this episode, please be sure to subscribe, rate, and review our podcast wherever you find your episodes. I'm Jeff Murphy, and no matter where your path takes you, be proud to be you. The Proud to Be You podcast is produced by Boston University Alumni Relations. Our theme is from Jump and APM Music. To learn more about Proud to Be You, visit bu.edu/proudtobeyou.